So, welcome to this episode of the Pro Age Woman Summit 2023, Real Women Aging Unapologetically. Our guest today is Dr. Rachel Rubin, a board-certified urologist and sexual medicine specialist. I'm going to read a little bit about her bio so you can get a sense of who is she and how does she have such amazing knowledge to share. So she is an assistant clinical professor of urology at Georgetown University and owns her private practice in the Washington, D.C. area. She is only one of a handful of physicians who are fellowship trained in male and female sexual medicine. Dr. Rubin is a clinical researcher, a vocal educator in the field of sexual medicine. In addition to being an education chair for the International Society for the Study of Women's Sexual Health, which is ishwish.org, she also serves as an associate editor for the Journal of Sexual Medicine Reviews. Her work has been featured in the New York Times and PBS. So welcome, Dr. Rubin, and thank you for being here to discuss your topic about hormones and pelvic health for the woman 50 plus.
Thank you so much for having me. And it's one of my favorite topics.
No doubt. You've been very vocal and on screen and in the news. So we are thrilled that you can continue to bring this knowledge forward to the general public. So our first question is, how can hormones prevent urinary tract infections or UTIs?
It is so incredibly important for hormones to protect bladder and genital health. So we don't often think about the bladder and menopause. We think about vaginal dryness. That is something that is commonly discussed oh, menopause comes with a little vaginal dryness. And I actually think that term is killing women. The term vaginal dryness is killing women because all doctors minimize vaginal dryness. They say, oh, it's okay. You've got a little dryness. Here's some lubricants. Here's some moisturizers. Suck it up, lady. It's fine. But what providers don't understand is that it's not just a little bit of vaginal dryness. After 50, sometimes earlier, but certainly after menopause, what happens is the tissue, which is rich in hormone receptors, the estrogen receptors, testosterone receptors, and they're all throughout the vulva, the vagina, the urethra, and the bladder, right? They lose that hormonal support. And so they get dry and irritated and cracked, and the bad bacteria start to grow. You actually lose the acidity to fight infection. And so what happens is that comes with a constellation of both symptoms and real visual signs. And we call that genitourinary syndrome of menopause, or GSM. Genitourinary syndrome of menopause. And it's not just a little vaginal dryness, although that does happen. It's urinary frequency and urgency. It's itching, burning, pain with wiping, pain with sitting. You see visual changes. You see red and irritated tissue. The urethra can start to protrude. The craziest thing happens. You start to lose your labia minora. They start to literally shrivel up and disappear. If penis is shriveled up at age 52, we would have a vaccine, people, and Pfizer would be at the head of it. And so we're not talking about this. And the thing that can kill and does kill women is urinary tract infections. And so because of the lack of hormones, the bad bacteria grow. You can't fight infections. The tissue's raw and irritated. It is often it's a perfect storm for urinary tract infections, which can kill you. They can kill you at 90. They can kill you at 80. And what we want to see as doctors, we want to prevent that from happening. And so the only way to prevent that is by giving the tissue back the hormones that it does not make anymore. And so there are local, incredibly safe treatment options that are not hormone therapy for the whole body, although there are reasons why you may want hormone therapy for your whole body, but local therapy, hormone therapy, either vaginal estrogen or vaginal DHEA, can support the microbiome of the vagina, the bladder, the urethra. And we have great data to show that it prevents urinary tract infections. So this is important, not just for your 45-year-old executive or your 55-year-old mom on the go, but this is actually important for grandma and great grandma, especially the ones in the nursing home, the ones getting up to pee all the time. I don't want that woman to get up in the middle of the night because she has to pee and then she falls and breaks a hip. And so that's my whole point, is that the lack of hormones is killing women, and we have to do a better job of advocating for that.
Yes, and that's been the biggest reasons for in nursing homes why so many millions of women are entering into nursing homes, because of pelvic floor, urinary tract issues. So this is a beautiful insight. And I know your work and research is basically promoting what you just said. So let's have all general doctors, sexual health doctors be part of this process of what is your hormone levels. So how do you test hormone levels? And is there a difference between classic hormone replacement therapy and bioidenticals?
So when it comes to genitourinary syndrome of menopause, local symptoms, urinary frequency and urgency, pain with intercourse, or urinary tract infections, you don't have to even test any hormone levels. There is no level of hormone that matters. Even if you're still getting periods and you have those symptoms, you could benefit from local hormones in the vagina to prevent those problems and to fix those problems. And there's no blood test that matters. What bioidentical means is a little bit of a marketing term. So bioidentical just means that if I give you an estrogen replacement, whether it's a patch, a ring, a pill, a cream, I can take your blood and I can measure your estradiol levels. All testosterone is bioidentical. If I give you testosterone, I can measure the testosterone in your blood and check those levels and know what that's talking about. We have many FDA-approved bioidentical products out there. And so the word bioidentical in the marketing world is often meant sort of compounded products, but the compounded products and the FDA products are all sourced from the same locations and the same places where you make the hormones. What a synthetic hormone is kind of like a birth control pill. When you take a birth control pill, it's a synthetic form of estrogen and progestin. You can't measure the levels in your bloodstream. So there are types of hormone replacement therapy, especially ones we used to give long ago that not many of us doctors prescribe anymore, but we used to give very synthetic forms of hormone replacement therapy in menopause. And it was those synthetic forms that had a lot of benefit, but those did show a few signs of danger or risk, and they're different than some of the formulations that we use today. But there are many FDA-approved products that are bioidentical, very safe to use, and can really treat hot flashes and night sweats, can help with libido, and help many of the symptoms of menopause.
Beautiful. So women really should, if they're starting to have any of these symptoms, they should really be an advocate for their symptoms and say, what can I do to help? What hormone, topical or ingested, should I be taking?
And it's really important that women understand that doctors do not get good training in menopause, and that you must advocate for yourself, but see a provider who genuinely is knowledgeable. And you want to understand that they're knowledgeable in evidence-based management of menopause. And so the best way to go is either through ISSWSH.org, the International Society for the Study of Women's Sexual Health, or the North American Menopause Society, which is menopause.org, and go to find a provider and look for somebody in your area. And we've had patients who've had to travel because they may not have a provider in their area. And so it is really important that you do your own research, that you look at evidence-based research, because there's a lot of non-evidence-based things out there, and that you know that you get to make decisions of what you put in your body, that doctors can give you advice, they can consult and tell you what their thoughts are, but at the end of the day, you are the CEO of your body and you get to decide what goes in it.
I love that. You are the CEO of your body. That is just a beautiful statement. There should be a name on a big flag.
We'll make
so
t-shirts.
So I've heard that testosterone may be important for women. Is that true? And what does it do?
It's very true. We have evidence, so much evidence, and we have a global position statement. The world got together, all these big societies got together and say, said and put out a publication a couple years ago that said testosterone works in women. The majority of the data that we have is that it works in postmenopausal low libido. Okay, that doesn't mean it doesn't work for other things, but the majority of the data that we have is for low libido in postmenopausal women. The very interesting thing is that we as women have more testosterone in our body than we do estrogen, but we don't think about it. We don't talk about it, but we have lots of androgens in our body, and we need androgens in our body. And so what we will learn over the next, hopefully not too long, but the next decade or so, is that it's not just about libido, but that there are androgen receptors in all of our muscles, in our bladder, in the urethra, the vulva, and the clitoris is a very androgen dependent, organ, and that we will see that if you don't have enough testosterone, supplementing it will be quite helpful for sexual health. And so although we don't have FDA approved products for testosterone in women, there is approved products in Australia through their form of the FDA, and we use male approved testosterone. And we tend to extrapolate and use a much smaller dose for our female patients.
Beautiful. How can we maximize our sexual health as we age?
There is no age with which sexual health is not important and cannot be maximized and optimized. And so the point is, if you care about this, and not everybody does, if you are not bothered by it and you are perfectly happy not having any orgasms or any sex, you're not broken. Enjoy your life. You get joy other places. But if you are someone who has an interest in sex, who used to love sex, who wants to love sex again, it is within your right. It is within your reach. And there are so many tools that we have in our toolbox, whether you are 89 years old, 55 years old, or 29 years old, we have a toolbox. And really what I do as a sexual medicine doctor, and I do this for all genders, is I deal with 4 things. I deal with issues of desire, arousal, orgasm, and pain. And there's a lot of overlapping issues. We deal with it in what's called a biopsychosocial arena. So we really look at the whole person, and we work with a multidisciplinary group of people to maximize your sexual health. You are a brilliant pelvic floor physical therapist, and so you know the importance of a collaborative approach when it comes to sexual health and quality of life. And it's just so important that people understand it doesn't matter how old you are. Your quality of life matters. It is important. If we are going to keep you alive with our cancer therapies and our treatments, the really important thing is, how are you living? What are you getting out of life? What do the years look like? And you deserve good ones. And so it's not a one size fits all. Not everyone is going to respond to all the same therapies the same way, but find a team of providers who genuinely give a crap about your quality of life.
I love that. And it opens the door for so many people to shed that shroud of shame that, well, I'm over 50, so I guess I shouldn't really enjoy sex anymore. I guess it's just the way it's going to be. In my work in pelvic physical therapy, a lot of people just thought it's normal to be leaking after giving birth for like 7 years, or that it's normal to have pain with intimacy. So I love the work that you're doing, Dr. Rubin. Keep promoting it. It opened the doors. I love that you're promoting the awareness of choosing what kind of lifestyle do you want to live. Every woman has a slightly different interest in what kind of lifestyle they want. They don't have to fit into a mold. So that's beautiful that you're opening up the door that people can explore. What is it? How do I want to live my life? And if I want to have improved sexuality, there are options. I can do that. So how cool is that? So thank you.
You're welcome.
Yeah. So do you have any particular, I know part of the Pro-Age Women Summit is that there's a gift, if there's a website or a link that you have gifts for our attendees, if you want to talk about it, or if not, where can they find you, or where can they find other practitioners like you?
Yes, please sign up for our newsletter. We send out lots of fun tips, information about our practice. We've got a lovely blog on our website, but it's rachelrubinmd.com. Please sign up for our newsletter. And then you can always follow along on all social media channels. I'm at Dr. Rachel Rubin, at Dr. Rachel Rubin, and we'd love to connect.
Beautiful. Well, thank you again so much for your insights, empowering knowledge for all women. Look forward to connecting again. Thank you, Rachel, Dr. Rubin.
Thank you.
Appreciate it. Welcome.